Just over half of hospitals in Nebraska lost money last year.
Today, the Nebraska Hospital Association addressed the issue. The Columbus Community Hospital says their profit margin was around 14% before the pandemic. In the last 8 months, it's been a negative 0.1%. One problem is a growing number of people on Medicaid. Since 2019, Nebraska hospitals have seen a 60% rise in uncompensated care in the program, meaning they're left to cover the costs. NHA is calling for Nebraska lawmakers to pass a bill to establish a Medicaid directive payment. And the group says the legislation would take advantage of money Nebraska's been leaving on the table and will not impact state finances.
We hope the legislature moves forward with this because with the turn in the financial situation of our hospitals that we've seen in the last few quarters, the closures of services that we've experienced in the last year is going to continue if we don't have this type of action.
NHA says the bill would help them be paid closer to the cost of their services. Norquist added the bill has more than 30 co-sponsors and the governor's team is supportive.